Good morning, good afternoon, good evening. Welcome to this webinar on the request for proposals for the environmental dimensions of AMR for ICARS. My name is Aniek Lenglet. I'm the acting scientific director at ICARS at the moment and have been involved in drafting this RFP. And we welcome all of you. It's really exciting to see how many people have already joined the call and all the countries that you are calling in from. So big welcome. I think for many of you, this might be your first exposure to ICARS, so we've also tried to include a bit of more information around the organization. Maybe just some housekeeping. If you have any questions related to the presentation, then the easiest would be that you post those in the Q&A section of this webinar, and you can see a little button in the little menu at the bottom of your Zoom screen where it says Q&A. So please click on that and post your questions. We will try to either answer those in real time in the chat, or otherwise we will take them at the end for the question and answer session. And otherwise, for people just joining, it would be really great if you could put your name and your affiliation and where you're calling in from in the chat. So with that, I would like to hand over to Dr. Sunday Ochai, who is a science advisor at ICARS working on climate change and AMR. And he will be leading you through a little bit around this RFP and open up for questions afterwards. So thank you very much, and Sunday, over to you.
Thank you so much, Dr. Lenglet. Can you confirm if you can hear me?
You're loud and clear.
All right. So as mentioned by Aniek, I would like to welcome you to today's webinar on the request for proposal for the environmental dimension of AMR. And presenting today is myself, Sunday Ochai. As Aniek mentioned, I'm the science advisor for climate change and AMR at ICARS. And Aniek will be here to also help me with questions and provide further insight on anything that you may have or questions you will have regarding this presentation. As an introduction, ICARS is an international organization that collaborates with governments in low and middle income countries to create and test solutions for AMR that are tailored to specific local contexts. This approach is usually based on the recognition that a solution is effective in one context. That does not necessarily mean that it will be effective in another context. So for example, a solution that is effective in a country such as Denmark might not necessarily be suitable or economically viable or sustainable in another context, for example, let's say Ghana. As part of our responsibilities, we offer funding and technical expertise across the entire One Health spectrum. And ICARS was first initiated by the Danish government in 2018, but since then it has become an independent and self-governed organization receiving funding from different member states as well as various foundations. We currently have over, next slide please. Okay, thank you. We currently have I think it's moving quite fast. Sorry about that. Okay, so in ICARS.
You have control, Sunday.
All right, okay. We currently have over 41 active projects in about 20 countries and territories, spanning the human, animal, and environmental sectors across Africa, Asia, Europe, and Latin America, as can be seen on the map. And also here, you can see the little connection cycle here indicates projects that are across the One Health spectrum. And also the animal and fish silhouettes represent projects in the agri-food systems, and the human silhouettes represent projects in the human sector. But also, interestingly, we have the little figurine of a tree here that represents the project in the environmental sector. But here you can see that across all the projects, we only have one project that is actually in the environmental sector. And this highlights the significant underrepresentation of the environmental sector in AMR interventions, even on a global scale. As mentioned in the previous slide, the environmental sector is the least described One Health sector in terms of AMR. And this is primarily because of the role of the environment in development and transmission of AMR is not yet fully understood. Bacteria in water, soil, air, and also in crops serve broadly as sources and reservoirs of AMR, which pose significant risks to human and animal health. And the influx of AMR genes from livestock and human waste through manure and sewage, along with the entry of antimicrobial residues from pharmaceutical industries, as well as systems such as intensive crop and livestock farming and hospital waste, actually exacerbate and increase this issue. Additionally, when we look at the built environment, looking at cleaning products, including disinfectants, improper waste, and the design of the healthcare facilities actually contributes to the spread of AMR. Therefore, the overall scope of this request for proposal is to focus on public health by mitigating the evolution and also transmission of resistance in both natural and built environments, thereby reducing risks to human and animal health. Proposals are expected to demonstrate first proof of concept, which means that the proposal will be expected normally to provide evidence that demonstrates the proposed interventions are feasible and appropriate or transferable to the local context. And here we use the term environment loosely in this context to include soil, air, the built environment, and water, which includes sewage. Hotspots for human and animal exposure include areas with high concentration of antimicrobial residues, drug-resistant bacteria, antimicrobial resistant genes, as well as associated mobile genetic elements. And examples of such hotspots are actually the health facilities, intensive livestock and aquaculture, production systems, as well as areas downstream from pharmaceutical manufacturing facilities where waste is discharged. And also interventions to be considered in these areas could include testing proven interventions from other settings, as well as introducing new or innovative solutions. Here, we expect that proposals should be targeted at the generation of contextualized evidence for changes in policy and practice using an intervention and implementation research framework. And here you can see this slide presents an implementation research conceptual framework of AMR interventions that is structured into 3 phases. The first phase basically defines implementation strategies, and as part of the objectives is to understand the context, identify challenges, and determine possible strategies to address these challenges. And the second phase here actually talks about designing the implementation strategy and develop strategies to tackle the identified challenges, focusing on actors, actions, targets, temporality, outcomes, and justifications. Strategy areas include public oversight, organization and individual provider improvement, as well as community empowerment. And in the phase 3 of this implementation and intervention framework, we talk about testing the strategy outcomes. Here, the objective is basically to evaluate the effectiveness of the strategy in real-world settings, focusing on target population, systems, services, and implementation aspects. This usually includes improvements in, for example, clinical health status, behavioral change, decrease in morbidity or mortality, strengthening surveillance, reduction in AMR and AMU, and also human development in or human capacity development. And also we look at key implementation metrics such as acceptability, adaptability, adoption, and the appropriateness within the context, and also the cost effectiveness, the coverage, the feasibility, the fidelity, and the sustainability of these interventions. So overall, the framework aims to provide proof of concept, proof of implementation, and inform scale-up for sustained integration within the One Health spectrum. And we expect that the proposals that will be submitted should include, at least the minimum, a quantitative methodology to evaluate the impact of risks associated with the mentioned exposures that I just did previously. And also they must specify how the teams that are involved in this proposal will be organized in terms of study design, tools, analysis approaches to evaluate, the effectiveness of the interventions proposed, and also to look at the enablers and as well as the barriers for their uptake, and also to conduct comprehensive behavioral change and economic evaluations, and also to look at the policy impact evaluation, which is usually always encouraged in every ICARS project. And here it is very important to note that purely observational studies, such as those solely measuring AMR burden in the environment or establishing surveillance system for AMR in the environment, might not be or will not be considered for this proposal round. The eligibility criteria for this request for proposal involves that first, the service setting or research institution and affiliated ministries must be based in a low and middle income country. And as such, they must appear on the dark list for 2024 and 2025, which we have provided in the call for proposal. And also we expect to see a high level of country ownership, where we expect the relevant ministry endorsement through either a letter of support or a form of commitment, and that the main research institutions leading on the proposal are based in the low and middle income country in which the interventions are aimed to be tested. This can be either an academic institution or research institution in collaboration with relevant ministries. And also we expect that the name of a contact point within the relevant ministry must be included in the proposal template. Also, the relevant ministry in this field of work must provide a letter of support, as I have mentioned, and this letter of support must include first, a reflection that the topic of the proposal is aligned with the areas of priority as enshrined in the National AMR Action Plan. And also we expect to see a commitment to follow the progress of the project and also remain engaged in its implementation and the entire lifespan of the project. It should also be noted that before any grant agreement can be signed, the requesting institution and ICARS, or between ICARS and the requesting institution, there is an expectation that the relevant ministry must sign a memorandum of understanding, which can be seen in, you can contact us to get more details about that. Also, it is important to mention that your proposal must align with the National Action Plan, as I have mentioned, and all proposals must show that the proposed interventions are in line with existing country priorities for AMR mitigation. And this can be done by illustrating where this intervention area has been highlighted in the NAP for AMR or in any other strategic document in the country. Also, it is important to note that in ICARS, all ICARS projects aim to build a comprehensive business case with data on intervention effectiveness, as well as behavioral change and economic impact, so that the evidence can easily be used to introduce or revise policies within the country. As such, what we expect to see is that there is a top-down ministerial level of support for the proposal with an articulated commitment to use the results from the project for policy and also for practice change. And also, as part of our model, we expect to see a bottom-up approach which relates to study design, study protocols, development, study implementation, analysis, as well as project management will be executed by the research institution in the country. And in the event that the project is based in a sub-national level, as we have noticed in some countries, the country has, where a country has a decentralized governance or a federal system, ICARS will generally expect to see letters of endorsement from both the federal and the sub-national ministries. And for the submitting institution, proposals must be submitted by, sorry. Proposals will be expected to be submitted by a single institution or a consortium of institutions in the case of partnership, consortium, but we expect that only one proposal must be submitted on behalf of everybody in the consortium or partnership. And also, all institutions must be based in low and middle income countries according to the dark list that I mentioned earlier. And the lead institution must be a university or other research institution, either public or private, in the country and in which the project will be implemented. This lead institution will be expected to be a registered legal entity and be willing and able to enter into a contractual agreement as the commission organization with ICARS, and the successful institutions will be required to comply with the grant conditions of ICARS that will be provided once we get to that stage. And also we expect that the institution must demonstrate equity, diversity, inclusion in the project team, and must also have submitted a completed application as per the guidelines of this RFP. And it's important to note that we will not be able to accept incomplete applications or applications that will come after the deadline. It should also be noted that profit-making organizations and international organizations that will include the United Nations organizations or any international academic or non-profit or for-profit institutions are not eligible as the lead research institutions for this call. Also, we expect that they can be collaborators, of course, and they can also bring their own funding or in-kind contribution to these institutions. Also, it is important that as only a single institution will receive the fund disbursement from ICARS, we expect that the lead organization should be able to disburse funds to partner institutions. And additionally, it is important, I mentioned that we expect partnership contracts to be signed between the lead institutions and partner institutions within the first 6 months of the project lifespan. Also, project teams are required to have the necessary expertise, such as we expect that the core project team should be able to reflect on the disciplines required to design and implement and translate knowledge from intervention and the implementation research project. As such, every proposer is encouraged to have the following skill set: environmental research, studies design, and data analysis for both quantitative and qualitative data analysis, intervention research experience, implementation research experience, behavioral science and research experience, health economics experience, policy-related experience, as well as ability to deliver on high-quality outputs. And also, it's important I mentioned that the project team can actually subcontract subject matter expert from any country. However, we always prefer that this SMEs should be based in low and middle income countries. And subcontracted SMEs from high income countries must be clearly justified and may not be allocated more than 10% of the total budget. And as part of the legal compliance and knowledge translation, the successful institution will have to comply with the grant conditions, including organizational policies of the offering institution and ICARS policies, including the code of ethics and professional conduct, and the anti-bribery, fraud, and corruption policies are publicly available on our website. Also, it's important I mention here before I move to the next slide, that ICARS grant agreement template can be requested by email through the email address that is on the call for proposal, which is the rfp_eda@icars-global.org. And following the ambitions of the submission of this proposal, we expect that researchers are willing to actually be open to the framework of open science and should be willing to share. And as part of the submission of this proposal, when submitting, we expect that you should include a detailed proposal, a Gantt chart, a template, a budget guideline, as well as budget template. Additionally, we expect to see the curriculum vitae for the core project team. And also we expect supporting documentation from the relevant ministries, as I have mentioned. And you should also ensure that you include the National Action Plan or other strategic document on AMR that supports the proposed intervention. Also, I would like to mention that the criteria for proposal evaluation will be based on the relevance of the proposal submitted, the scientific quality and merit of the proposal, and the feasibility to carry out the intervention and implementation plans that have been proposed in the proposal submitted, and also to see the level or to demonstrate the level of impact that will be expected to be seen in this intervention. And generally, ICARS will undergo the internal evaluation, where first we'll have a short list of 5 proposals that will be evaluated internally by ICARS, and these 5 proposals will be submitted to the External Technical Advisory Forum that will now rank these 5 proposals and make recommendations for funding to the executive management. And the communications for the outcome of all the proposals submitted will be made available, and feedback will be received by latest mid-October 2024. At this point, I would like to entertain questions regarding the overall request for proposals and based on questions from the webinar that I just presented. Thank you so much. I hand over to Anik.
Great, thanks a lot, Sunday. There's been a few questions that have come through on the chat, and also I see in the Q&A. So maybe Sunday, I will take a few of the first ones because I think maybe they're a bit more relevant to me, and I don't know if you're able to open the Q&A while I'm doing that, and then maybe have a look at those. So
Okay.
the first question, or a few of the questions actually, have been around what is the allocation of these grants and the duration. So the grants will be up to $800,000 US with a duration of 4 years. And I say up to, so they don't need to go all the way up to 800,000. They can be less than that as well. There's been questions around whether we will be sharing the slides. So everybody that is registered for the webinar, we will definitely be emailing the slides and also the recording. And we will also make sure that the slides and the recording are available on our website. There was a question around how many projects will be funded in total. I think as Sunday mentioned, there will first be an internal review of all the proposals received, and then the top 5 will be shared with our external technical advisory forum, and they will then rank these 5 proposals, and based on that ranking we will decide which ones to fund. So I can't actually give you a concrete answer of how many of them will be funded. It really depends on this ranking by our technical advisory forum. There was a question around what the consortiums should look like for this proposal and what the country composition should look like. As Sunday explained, we expect that the research will be conducted in a single low and middle income country. So it's not necessary to formulate a multi-country consortium. It can be a single country consortium. Okay, so then I'm going to the Q&A. Sunday, maybe you can take the first one. I need a reminder on the definition of the environment in this call. Do you mind taking that one?
Yes, sure. So, like I mentioned here, we define environment loosely as both natural and built system, as well as external physical, chemical, biological, and also occupational factors, as well as associated behaviors, are seen as what encompasses this environment here. So here we see both built and natural environments, as well as the associated behavior.
Great. Then I see there's a question from Abebe Negeri from Ethiopia. Can we apply for this grant to implement healthcare facility environmental AMR research at AMR surveillance healthcare facilities in Ethiopia? Because we do not have such programs in Ethiopia, and we do not know the burden of AMR pathogens in healthcare facilities. Sunday, do you want to take that?
Okay, so like I mentioned, ICARS generally, even though we see surveillance as a very important intervention activity to do, we don't see it as, it's not a key area of focus for ICARS. So as much as possible, we make sure that the interventions that we fund are not just focused on surveillance. Surveillance can form just one of the work packages, but not the entire project. So I would say that the proposal should not be entirely a surveillance proposal, but surveillance can form just maybe at most one of the work packages in the proposal.
Great, thank you. Then there's a question from Sukanta Chowdhury. What % of overhead will be allowed? So I can take that one, Sunday, if you don't mind. If you look on our website, there are very specific budget guidelines that are included as part of all the materials for this request for proposal. If I recall correctly, the maximum overhead that ICARS would accept is 15%, but there has to be a justification for that overhead. So, for example, you would need to have some kind of an institutional documentation to explain why the overhead is the amount that it is. Then there's a question from Thomas Kesterman. Sunday, maybe you can take this as well. Should all proposals include a scale-up phase? And what if the pilot phase shows a limited or null impact?
So as I mentioned in the presentation, we expect that every project should be able to have, you should be able to demonstrate the ability to scale up and also the feasibility of the acceptability on a more general scale in the country. So in every proposal, we expect to see how the scale-up plan is, and we expect to see that. So like you mentioned, if there is limited result or the pilot shows limited or no impact, then it is also an indication that the project in itself will not have the needed or expected impact that we hope to see in the country. That is why we expect that interventions that you intend to test are interventions that have been proven to work in either your similar context or context that can be transferred into the local context. So as part of the requirement, we always expect to see a scale-up phase in the proposal. Thank you.
Great, thanks, Sunday. Then there's a question from somebody that's anonymous. Can NGOs apply for the grant with endorsement from the concerned ministry?
All right, as we mentioned, non-governmental organizations or for-profit or non-profit are not expected to be lead applicants on this call. They can form part of the bigger consortium or partnership, but we don't expect them to be the lead applicants for this call. Thank you.
Okay. Yeah, maybe just a nuance towards that. So if the NGO in question is actually a research institution of some sort, then it
Yeah,
would be possible. But a
yes.
pure non-governmental organization without a research experience or expertise would be difficult. Then there's a question from Justine Alinaitwe. I hope I pronounced that correctly. Is it possible to have a project across 2 to 3 countries?
Okay, I think Anik actually answered this earlier. We expect that so like we mentioned, the intervention should be country specific and there should be a level of country ownership. So we don't necessarily see the need to have a multi-country project or multi-country proposal at this stage.
Thank you. Then there's a question from Shafiq Rehman. Are international organizations not eligible as the lead institution? Is that correct?
Yes, that is correct. And as we have mentioned earlier also, we expect to see a level of country ownership and support from relevant ministries. And we expect that the lead institution should be based in the low and middle income country. Thank you.
Great. Then there's a question around country ownership and eligibility. Dr. Bilal from Pakistan. Dr. Bilal, I would direct you to the slides that Sunday presented. And I would also suggest that you check the request for proposal text because this eligibility is quite specifically outlined. I see you have your hand up. Maybe you can just clarify in the Q&A a little bit more what you mean. We have quite a lot of questions to get through, so I would prefer to go through the questions as they're coming in, if that's okay. Then Sunday for you, I want to ask, is the grant also open to people or for organizations from Indonesia, and can we apply?
So in the call for proposal, you see we submitted a list to the dark list 2024-2025. So generally we fund only countries that are within the dark list. So if Indonesia falls within that, then we can fund that if if the proposal is accepted. But in addition to that, we also have our security check that we perform, depending on whether it's a high risk or low risk or middle risk. So that usually requires an additional step to undergo before a final decision is made. Thank you.
Great. Then the next question is in the map. I'm not sure what the map refers to. There are some listed countries, mostly English spoken. Is it limited to only these countries? So no, we don't limit the request for proposals to only English speaking countries. However, all proposals that are submitted must be in English. And also it's important that you reflect that the project management with ICARS will be exclusively in English. So all the reporting and the financial documentation during your project will need to be in English. But we are very happy to accept proposals from any country, regardless of the language that you speak. Then Sunday, I don't know if you see it, there's multiple questions from James Muleme. So the first is, do we need partners from the north?
Okay, so as we mentioned, we hope to see more of the partnership coming from within the country, but we also mentioned that you can get subject matter experts from any part of the world, preferably from the ELMIC region. But should you have a partner or a subject matter expert from the north, remember that it cannot be more than 10% of the total budget. And
Great.
also the second one says, does this mean that the proposed projects should utilize the framework of identify, implement, and evaluate? I think the simple answer to that is yes. And if you go through the slide which will be shared, you can see more details about each of these phases that you have highlighted here. And when we talk about environmental AMR, do you think One Health approach would be allowable or we keep to environment? So one of the key aspects of all the projects we have in ICARS is actually that of very high stakeholder engagement. So we wouldn't mind to see a One Health approach being put into this proposal. But like you have seen, it's not entirely an environment project, but it's an environmental dimension of AMR project. So if the dimension requires bringing in expertise from animal health, human health, we'll be so glad to receive that. Over to you, Anik.
Thank you. Then let me see. From Claudius Gouffet, does the project include capacity building on techniques such as UV treatment of waste?
So as one of the core strategies of ICARS is capacity building. So in every project we fund in ICARS, we expect to see a level of capacity building. If this capacity is required for the needed intervention that has been proposed in the proposal, is something that ICARS is more than happy to support.
Great, thank you. Then there's a question, can we schedule follow-up meetings or calls with your team if we have further questions? We plan to cover multiple aspects from science to society, so a call, especially to know if any of our objectives is not a priority, would be beneficial. So maybe I can answer that. So yeah, there's a generic email address in the request for proposals. I think Sunday also mentioned it, rfp_edar@icarsglobal.org. You are welcome to write any additional questions you might have in that, and there's multiple people that are monitoring this inbox to provide you answers as quickly as possible. Depending on the questions, we might be able to schedule up a follow-up call, but ICARS, as you know, is quite small. We're only 30 people, so it might be difficult to have in-depth calls with every individual team that is interested. So what I would suggest is that you actually try to formulate your questions as specifically as possible over email. And if then is still required, we can see if we can schedule a call. Okay, the next one is the deadline of application, and is it a single stage application? From Paul from Makerere University. Hi, Paul. Yes, it is a single stage application, or at least for you, it's a single stage application. I think the review process is multiple stages. The deadline at the moment is the 1st of August 2024, so you have 6 weeks until then. Then Abebe Biteo, what does the following statement on page 4 of the RFP really mean? Purely observational studies, solely measuring AMR burden in the environment, establishing surveillance from AMR in the environment will not be considered for this proposal round. Sandy, do you want to take that?
Yes, thank you so much, Abebe. As you mentioned, we have answered this in the course of the presentation, where we said that ICARS, as much as possible, does not fund just purely observational or surveillance or prevalence study to measure the burden of antimicrobial resistance. So we expect that if the project or the proposed project is entirely an observational study, ICARS will unfortunately not be able to fund that. But to say also is that at least or at most, the observational study can just form one of your objective or one of your work packages, but cannot be the entire project. I hope this has answered the question.
Great. Then there's a few repeated questions which you have already answered. Then from Varsha Sridhar, if we are applying as a consortium, can the ministry support letter be for one of the partners in the consortium instead of the consortium as a whole? Maybe I can take that one, Sunday. So the support letter needs to be for the overall project proposal, and by therefore default also somehow an endorsement of the team that has been identified in the proposal, so whoever the consortium is. So we don't need separate letters for each part of your consortium, but we need a single support letter that clarifies that the project proposal is matching the national priorities on AMR mitigation, and ideally is also aligned with what is included in your national action plan. Then the next question is, do we need to submit support letters from relevant ministries with the application? Is it mandatory? Do you want to answer that, Sanjay?
Yeah, I think the simple answer to that is yes. We expect to see a letter of support from the responsible or relevant ministries. So when you submit the application, we expect to see this letter at that stage as well.
Great. Please, could you define international organization, please? INGO based in LMIC is defined as such. Yes, that is the case. So any international organization, regardless of where they are based, would be classified as an international organization. So if you are an international organization and you are interested in this request for proposals, our suggestion would be that you actually link up with a research institution in the country where you are based, which is legally registered as a public or private research institution in the country, and the relevant ministry, and try to explore if you are able to provide subject matter expertise into the proposal, as opposed to actually managing the project yourselves. Then from Martha Tadesse, do you recommend to do observational studies or review of articles for baseline data before the intervention? Do you want to answer that, Sunday?
Okay.
Yeah.
Yes, so as part of most of our projects, we always expect to see a baseline data, mostly coming from either literature or just observational studies where you try to either gauge knowledge, attitude, practices, and all of that, just to give you a baseline data to be able to also measure the change at the end of the day. So we expect to see that, but as we have mentioned, the surveillance or the baseline cannot form the entire project. It can only be an objective. Thank you.
Great. Then the next question is, does scale-up use of funds allow capacitation of government environmental labs with infrastructure, renovation, equipment towards the lab producing the AMR result data? I can maybe take that one. Okay. So Dr. Ochai earlier mentioned that as part of this request for proposals, we are not interested in proposals that are purely looking at the generation of observational data. So if the request for proposals is exclusively on establishing the burden of AMR in the environment, or measuring the prevalence or the concentrations of antimicrobial residues in the environment, this would not be considered as part of this request for proposals. We are really interested in the testing of real-world interventions to reduce the transmission of AMR from the environment to either humans or livestock. As part of that, we obviously recognize that surveillance data is crucial and it's really important, and it also will be needed in order to measure the impact of any intervention. So within that, we do expect that the proposals will include a large component related to lab, and as such, if that requires then also the infrastructure renovation or equipment of lab, then that would be considered. Maybe just a little bit of a nuance on that answer, that lab equipment is quite expensive, and especially the full renovation and infrastructure change around labs would be quite expensive. So that would also probably go into the consideration of the proposal, because it's likely that those types of costs would actually dominate the grants. And so that would be something that we would have to take into consideration. I think that also answers the question from James Muleme around the supporting of laboratory upgrades. So I think we've also answered that one. From Rashid Suleiman, Sunday, maybe you want to take this. Do we need partners from other countries, and what maximum number of members of each country? And can we have postdoctoral students?
Okay, so as we have discussed earlier, as much as possible, we expect to see in-country partnerships. As we mentioned, having a multi-country partnership might not actually yield the desired result and bring about the country ownership that we expect to see as part of the proposal. And also, there is no maximum number of members that you can actually recruit within the country. We always encourage that you should do a more robust stakeholder analysis and mapping to ensure that relevant stakeholders are brought into the core and also into the proposal, and members that can be very essential for the actualization of all the set objectives of the proposed intervention. And as part of most of ICARS projects, we always have a component of capacity building, which has to do with master's students, PhD students, and also postdoctoral fellows. So if your intervention will require the services, or will have a component for postdoctoral fellowship, that may be considered by ICARS. Thank you.
Great, thanks. From Modest Chua, is it possible to attach the proposed project to the existing national wastewater-based surveillance? I can take that. So yes, of course, definitely. If you already have an established wastewater surveillance system, that also means that you have probably quite reliable baseline data on the problem and the burden in wastewater. But the proposal would really need to explore interventions that would reduce the transmission of AMR, either genes or antimicrobial residues, from that wastewater to humans and or livestock. So you would need to be able to illustrate in your proposal that this risk for transmission is also present, and obviously using then the data from the surveillance system to be able to inform the measurement of the success and the impact of your intervention. And there's a question from the National Public Health Laboratory, I think, NPHL, from Olympia Machange, which is under the Ministry of Health. Can it apply even though it has no legal entity since it's under the ministry? So Olympia, I'm assuming that is possible. I think one of the important things to clarify then in your proposal submission, and maybe you could include that maybe as an annex to the proposal, is whether the National Public Health Laboratory is also in a position to receive funds directly from an external source, which would then happen through the grant, or whether those funds would then also need to go through the Ministry of Health. And if that's still not clear, then feel free to email me or to email the generic inbox, and we will try to get back to you with more detailed information if that's necessary. Okay, so then there's a question from Abebe B2. By maximum budget allocated to the successful proposal is 800,000 USD for a project duration of 4 years. Does it mean for one project? And reframing the question, how many projects will be funded for this round? So maybe I will just take that again. So yes, this is 800,000 USD for a project duration of 4 years for a single project. In terms of the number of projects that will be funded, as I tried to explain a little bit earlier, what will happen is there will be an internal ICARS review of all the original proposals received. And then we will be submitting the 5 top scoring proposals to our technical advisory forum. And this is an external body to ICARS made up of experts in the field of the environmental dimensions of AMR. And they will be ranking those 5 proposals from the top 1 to the 5th. And based on that ranking, they will submit a recommendation on which proposals they think merit to be funded. So at this moment, I can't tell you how many project proposals we will be funding, because it will really depend on that framing, on that ranking of the from the TAF. For multi-institutional projects, can each get the 15% overhead. That's from Lillian. I can take that as well, Sunday. So if there are multiple partners involved in a project implementation, then we would expect to pay the overhead that is set by those institutions. So most institutions will have a formal overhead limit, and we would, if the proposal is selected and becomes successful, we would probably ask for some clarifications on the budget moving forward and before the grant is signed. And so one of our requests there would probably be to get some official documentation around the overhead for each of the institutions. The overhead would obviously only count for the amount of the total budget that is going to that individual institution. So it's not that each institution gets 15% overhead of the total project budget. It would really only relate to the portion of the budget that they are receiving. Okay. Another question on whether the recording will be shared. Yes, definitely. We will be sharing the recording with everybody that registered for this webinar, and it'll also be posted on our website in the section related to the request for proposals. Then there's a question from Bangladesh. My organization is termed international, but it has no other branch in any nation and operates only within our territory. Though it has considerable collaborations with various international development and health program funders, does it hinder our eligibility to apply for the grant? Dr. Tamidul, I think you are probably working for ICDDRB. I would actually request that you maybe send us an email on the generic email address specifically related to this question, and I will just double check with our legal team. I'm not unable to answer that live, but I am happy to check specifically in that consideration for you with our legal team. Then the next one is from an anonymous person. Can a private university participate? Yes, definitely, as long as you are endorsed by the relevant ministry. And then maybe Sunday, you want to take the last one. Do you sponsor master's programs? And if yes, in which institutions?
Okay, to answer this, ICARS as an organization in itself does not sponsor master's or PhD programs, but through projects that we fund, individual projects are able to bring in master's and PhD and postdoctoral fellows into the respective projects. So through projects, yes, ICARS through the funding to the receiving institution can fund master's program or PhD programs, but ICARS as an organization does not fund or provide funding for master's, PhD, or postdoctoral fellowship.
Great.
Okay.
Thanks. So that's all the Q&A, but there are also multiple questions in the chat. So let me just see. I started keeping track. So I think the first one is this call for proposals only for the research scheme, or is it also open to intervention activities? So maybe I'll take that. So this research or this request for proposals is for intervention and implementation research. So we are expecting that the proposal will address the implementation of an intervention and also evaluate the effectiveness of that intervention, but also conduct implementation research around it to understand the barriers and enablers for that intervention to be able to be sustained within the context of a low and middle income country. So I'm not exactly sure what you mean by research scheme and intervention activities, but I think intervention implementation research is probably trying to bring those two much closer together. Then there's a question, Sunday, maybe you can take this. Can we use an observational and/or review the already existing issues on AMR as a baseline for this intervention and implementation research?
Yes, you can. Once you have the baseline data to be able to inform the change that you see at the end of the day, I think it's you can do that. Yes.
Great. And then there was a second question in the same one. what does the built environment mean and how is it different from the natural environment?
So when we talk about natural environment, we are talking about the ecosystem that has not been altered by structures that are built, and the built environment are actually erected structures that interfere with the natural flow of the ecosystem. So here we look at, for example, you have hospitals, you have schools, you have drainages that were constructed by people, and all of that. These are looked at as a built environment. So that's how it differs from the natural environment.
Great, thanks. Then there's a question, what is the maximum number of participants in a team? We don't have any restrictions on the number of participants. It's really up to you, and depending on how you set your objectives and your activities and what you require to deliver on those, we will consider any size of team. And I guess that will really depend on your ambition somehow and the budgets matching those ambitions. Then there's a question, does scale-up use of funds allow, oh, this was already asked in the Q&A, so I will skip that one. There's a good question on, can the grant be limited only to a state or a subnational entity instead of a country? Sunday?
Yes, so we mentioned we understand in some instances there are state or subnational entities that are able to or are self-governing to an extent. But in that case, we expect that we should see a letter of support from the federal ministry as well as the state ministries. So yes, subnational entities can apply, but we require to see the letter of support from the national as well as the subnational ministries.
Great. Then there's what percentage of the team should be students? So I can take that. So there's no set percentage for this. We try to encourage that all ICARS supported projects do include at least one PhD student, and in some cases multiple additional master students to be able to achieve the objectives. We all know that students are great ways of getting high quality research done in an effective and timely manner. So it really depends on the ability of the supervision for these students, also whether they're able to combine this with their coursework. We don't have any percentage or threshold on what that should look like. Can multiple partner organizations submit a common proposal? Yes, definitely, but we do expect that there's a lead institution that is identified, who then would also take the role of coordinating all the multiple partner institutions. And we would also expect that whatever endorsement letter comes from the relevant ministry also highlights that they are endorsing all the partners that are on that specific proposal. Then maybe you can take this one. Sunday, does ICARS have a plan to support the scale up of the IIR findings beyond the end of the project?
For now, we don't have plans for that. Maybe things might change in the future, but for now, there is no provision for funding scale-up activities. That's why we expect that there should be a willingness of the government to be able to take up whatever finding to inform policies and also changes that are needed in the system. So for now, ICARS does not have plans to fund the scale-up beyond the lifespan of the project.
Great. Sunday, did you maybe want to highlight a bit more the point around the downstream impact of the environment, and that there needs to be a reflection in the proposal around that, also in relation to the intervention that's proposed?
Okay, so we have received, even from this chart, a number of questions around the kind of interventions or proposals that we expect to see. So we realize that most of the interventions that have been sent are around quantifying the burden of AMR in the environment, or antimicrobial residues in the environment, on plants, in water systems, and all of that. We see most of this as mostly observational studies, and there is no specific intervention that is assigned to that. And we are also cognizant of the fact that the mere presence of antimicrobial resistant genes or the mere presence of antimicrobial residues in the environment does not necessarily pose a risk to humans and animals. So we expect to see that, for example, if you are talking about wastewater management and concentrations of AMR or antimicrobial residues in those, we expect to see a downstream implication of that to either human health, animal health, or even plant health to talk about. So we don't expect to see just a proposal that is just around quantifying burden in a particular system or in an environment or in a water body. You should be able to demonstrate the downstream implication of the presence of this. We understand that there's quite a very little or very few literature or studies around the downstream implication of the presence of all of this in the environment. But we expect to see some level of evidence. It could be either reports from the country, it could be gray literatures, it could be any evidence within the country or in other settings that have demonstrated that. So when you send in the applications or the proposal, we expect to see a level of justification showing the downstream implication of whatever problem you are able to identify in the environment. Thank you, Anik.
Great. Do you sponsor master programs? I can take that. So if you do include master students or even PhD students as part of your project proposal, we are open to seeing the fees for those programs to be included as part of the project proposal. But again, it will need to be balanced to some extent with the budget that's required for the remainder of the research. So yeah, please take this into consideration. What qualifications did the PI have? I think I answered that in the chat. So the PI should have a demonstrated ability to run research projects, to coordinate multidisciplinary teams, and also to have, therefore, a background in the implementation of formal research. So we expect that that's reflected in their CV that needs to be submitted together with the proposal. And then there's a question, can food safety be considered part of the environment? Sunday?
So food safety depends on what aspect of food safety, because when we talk about food safety, it goes across the agro-food system. So that might not necessarily be considered as part of the environment, except if the food safety comes as part of the downstream implication of the identified problem in the environment, then it can be a part of the proposal.
Great. And then I think the last question, will there be a call where observational plus experimental methods will be considered? So at the moment, this is the only sort of wide request for proposals that ICARS is doing. I also mentioned it in the answers to a few people in the Q&A in the chat, that this is the first time that ICARS is implementing or launching such a request for proposals for intervention and implementation research projects. Usually we co-develop these intervention implementation research projects together with country teams. So this is our first experience doing this. We're a very young organization, so I think this request for proposals will be a huge learning opportunity for us, but I can't tell you at the moment what that then will look like coming in the future. But please keep an eye out on our website for sure. So I think everything has been answered in the Q&A. I hope I managed to capture everybody that put questions in the chat. In case you have outstanding questions after this webinar, then I'm just putting the email address in the chat box again so that you have that. And maybe give it 30 more seconds. There's one more question. Sunday, should the project include both intervention and implementation research, or can it be one or the other?
We expect to see both. Yes.
Exactly. Thanks. So yeah, maybe just to say, we expect to see a proposal that both tests the intervention in terms of its effectiveness, but we also expect it to test the barriers and enablers of that intervention to be implemented in your context. And when we talk about barriers and enablers, it's around the behavior change for the target groups to actually adopt the intervention, but also an economic analysis of the intervention, and to really try to evaluate whether it's cost effective or if there's a cost benefit to use it, because you really need these three pieces of information on effectiveness, behavior change, and economic analysis to make a business case towards governments to change policies. Is it possible, sorry, there's more questions coming through on the Q&A, so we're not done yet, Sunday.
Yeah.
Is it possible to access financial support of this kind of project if the country has a project with ICARS in health matters? So I think, Cecilia, your question is whether if your country already is being supported through another ICARS project, whether you are eligible to also apply for this. The answer to that is yes. This is a competitive request for proposals, and we will consider all applications. Do you want to take the last one, Sunday?
Okay, so it says regarding intervention research, is that only testing which should be designed, or is it possible to develop our own using public scientific evidence and the national AMR plan? Second, should the postgraduate students be already registered? Okay, to take the first one, we mentioned that we expect to see a proof of concept, meaning that we expect to see that the interventions you want to test have already been tested in other contexts. But we are also open to innovative ideas that have been tested either in literature, in an experimental setting where it has been shown to work. So you can also bring that if you have that already within your literature or within your local context. And on the second question about should the postgraduate students be already registered, usually, as we mentioned, the course of the project is 4 years. So should you consider recruiting a PhD student, for example, it is important to note that the funding for the PhD student will end at the end of the lifespan of the project. So if the research and the study of the postgraduate students can be done within the lifespan of the project, then it's fine to bring in a completely new student, or you can support an already registered student whose objective aligns to that of the project you are proposing.
Thank you, Sunday. I see one more question in the chat. If you could maybe elaborate on what you meant by proof of concept.
Okay. So like I mentioned earlier, what we mean by proof of concept here is that the project in itself should have been shown to have an impact, or should be able to demonstrate a level of evidence of the feasibility of achieving the desired goal of that intervention, either in a local context or in a context that can be transferred to yours. So we don't expect to see an R&D research, research and development. We expect to see more of a proof of concept or proof of principle that will be seen, where it's a realization of certain idea, method, or principle in order to demonstrate its feasibility in the new context or in a similar context. So what we mean here is that we don't expect to see a research and development work being suggested or being proposed in your proposal.
I hope that answered your question, Dr. Ajayi. And then I really think this is the last question, but I encourage people to send emails to the email address that we provided, and that is also in the request for proposals. Is it possible for a PI to also be the PhD student in this proposal? And I can answer that. So yes, that is definitely possible. What would be important is that there is an illustration that the individual does have the skill set to be able to manage a project of this size, and also a project of this nature with all the multidisciplinary components. So yes, we would definitely, there's no restriction on whether you can or cannot be a PhD student as the PI. Okay, one more question, and then this is definitely the last question we're answering, and then I ask that you please email us. So this is from Shem Mokandu, I think from Kenya. Can I apply for funding from ICARS so that we can be able to address and identify in food safety value chain? I think you answered a question on food safety earlier. Is that right, Sunday?
Yes.
Maybe you can just, yeah.
Okay. So when for the environmental dimension of antimicrobial resistance proposal that we have just discussed, we try as much as possible that we want to see the environmental dimension of any intervention you are bringing. If the environmental dimension has to do with food safety issues across the value chain, looking at the downstream implication of the identified problems in the environment, then you are more than welcome to incorporate that into your proposal. But this very call for proposal does not cover entirely project on the food safety value chain. We expect to see an implication or the downstream implication of the identified environmental problem or environmental dimension of AMR in the food safety, if food safety is what you want to look at the end of the day.
Great. Thanks very much, Sunday, and thank you for the presentation and all the answers you provided. I think we will leave it at that. Thank you all for being here. It's really exciting to see how much interest there is for this request for proposals, and we're very excited to start reading them. Maybe just as a reminder, the deadline is the 1st of August. I have put the generic email in the chat, so feel free to reach out if you have any questions in the next couple of weeks related to this. And we leave it at that. Have a nice day and have a good weekend.